Welcome back to the Daily Mix. Today in our Health Matters, we are talking about AFIB, and joining us from the CardioVascular Institute of Scottsdale is Dr. Sadhu. Sadhu. I knew I was going to see. I got nervous, Dr. And nurse practitioner Kim here with us. But this is such an important matter because we have noticed that people who are having heart problems have blood thinner problems, all kinds of stuff. So that's what I like about the CardioVascular Institute of Scottsdale. Yeah. You guys actually address that, and let's talk more about what you guys do.
Yeah, so I'm a cardiac electrophysiologist, and Kim is an electrophysiologist nurse practitioner.
Yeah, and at the Institute, what goes on there?
Yeah, so an electrophysiologist is a cardiologist that specializes in heart rhythm disorders, such as atrial fibrillation.
So what is AFib?
So AFib is an irregular rhythm in your heart. It's often characterized as chaotic and not in the normal rhythm.
Yeah. How do we find out about these? What's the symptoms that we can tell for ourselves?
So some patients actually have no symptoms at all. Other patients describe shortness of breath, an erratic heart rate or palpitations. Some patients describe fatigue, and the other biggest one is shortness of breath.
Okay. So now, as we know that we were talking about this before, people have been taking blood thinners, taking different stuff, which actually is sometimes not good for them, right?
Yeah, so we know that patients need blood thinners to protect from stroke because atrial fibrillation puts you at a 5 times higher risk of stroke. What they don't know is it also increases their risk of bleeding, the blood thinners. And so they may be able to tolerate it for weeks and months on time, but over time the blood thinners then pose a problem.
Yeah, so you guys have found a way to actually get rid of those blood thinners and the different pills and stuff with a device.
Yeah, so this is what it looks like, and this is the Watchman left atrial appendage device. So it is a one-time procedure that may change one's stroke risk for a lifetime.
Wow, all right, and I see it here in the heart. So how does this, get to your heart?
So it's done through a procedure. It's not an open surgery. It's done under general anesthesia, but it's usually done via a tube or a catheter that goes up to the heart.
Yeah. Now, should people be worried? I mean, it's where you are going and touching the heart and stuff.
Yeah.
But you guys know what you're doing. But I know some people get a little worried, don't they?
They do, yeah. So this is actually a fairly simple procedure that's done through your groin, and it can take about an hour. Typically, patients stay about one night in the hospital and then get to go home the next day.
All right, and doctor, I know you're here. Hold on, let me just ask the nurse because that's usually who's talking. Especially practice. So, how long is recovery?
Recovery typically is just a couple of days. Most patients tend to recover pretty quickly. We usually tell patients 1 or 2 days afterwards they should be back to normal.
And then I'm going to come here to doctor. Okay, doctor. All right, while doing this, am I awake? Am I asleep? Or what goes on?
So the patients are typically asleep. They're under general anesthesia.
So, okay, so good. So if I need this, and again, where do we find out if we do need one of these, or how do we go about it?
Yeah. So they can contact our office. They can go to the website. It's www.cviscottsdale.com or .net, or they can contact us by phone.
So I love it too. And also I know we have, I think, a full screen here of actually an event that's happening that you guys want people to be educated and know what's going on, right?
Right. So we have an upcoming seminar in Fountain Hills within the next week or so, and it's there to educate the community.
There you go. And there goes the information right there. And all you got to do is make sure you make a reservation. Look at that, RSVP at 480-271-2018. And again, this is a great way to find out more about this device and find out more about taking care of yourself.
Absolutely.
Yeah, absolutely.
Thank you guys for stopping in.
Thank you so much.
Doctor.
All
right. And now my heart is stopped beating so fast. All right.